This is what I want everybody doing, all patients who are under active care, like doing somewhere around their appointments, right? During their appointment, right? So the before, during, after, and this is like the spinal hygiene part of it. It's designed to help improve spinal mobility, improve posture, right? Help improve curves in the spine and help reduce tension. So it's, several parts. There's the active cervical traction using the Pedibond wall traction. There's the vibration plates. We have the lumbar wobble discs out there. We also have the recovery chair, which is like an active, or an additional cool bonus they get to do. So we'll start on the cervical traction. So let me show you how to set this up first. So when you walk up to this chin rest, when they're standing next to it, should be positioned somewhere below their chin, but above their clavicle. If it's too low, they're gonna squat down super duper far to make the stretch happen, and that just won't be comfortable. If it's too high, they won't be able to get enough of a stretch, which is why we have all these different holes, right? So to get positioned and set up on this, all you're gonna do is lift this up out of the way, take this, put it around the back of your head so it's resting on your neck. Good. You're gonna pull the chin rest down underneath your chin, take an underhand grip. Good. Now you're gonna make 3 points of contact on the wall. I want your feet hip width apart. So why don't you stand up a little bit and bring your toes to the wall. Good. Now to do this traction, this is called an active traction, meaning that you are in control, that you have to actually move to make it happen. So to do the traction, all you're going to do, Kenna, is gently lower yourself down into like a seated position. And I want you to get 3 points of contact, your toes, your knees, and your elbows. And really relax into this position. So really try and push your low back out like you're trying to sit in a chair. Let your chin just rise up and shoulders relax. Good. You're gonna hold this bottom position for 5 seconds or 1 breath, and then you stand back up. This is 1 repetition, okay? Go ahead and repeat that. So again, toes, knees, elbows, down, hips back, chin up, shoulders relaxed. You take a breath and you come back up. You're gonna work your way up to 15 to 20 reps of this. If a person has jaw issues, like, oh, I got TMJ or my jaw hurts or what have you, this can go on the forehead, okay? And that way they can get a similar traction by putting it on the forehead instead of underneath the chin. When they're done, have them wipe it down so it's ready to go for the next person. So 3 points of contact, toes, knees, elbows, hip width apart, underhand grip, down and relax, back up, okay? All right, next is the vibration plate. So let's get some people hopping up on there. Again, purpose of this, the vibration therapy, improve circulation, get some muscles working, right? Improve balance, improve posture. It's automatically set for 10 minutes and we wanna keep it there. So when they get there, just press start, stop. Let them know, hey, there'll be a bit of a wobble. Go ahead and press start, stop. And then you want them to increase the speed, ideally 75 or over on the speed, okay? But again, you're gonna have them take it to tolerance, okay? And then while they're on here, the whole point is just to be in good posture. So when you're on this vibration, you're not gonna wanna be in bad posture. Your body will kind of automatically make you posture up, which is pretty cool. All right. So again, you're improving circulation, you're improving both blood flow and lymphatic drainage. It's getting muscles contracting and working. So to get you to not get knocked off of this thing, your muscles are constantly working to keep you balanced, right? And you can tell people, hey, when you're on this, feel free to move around a little bit, like good old Gary, all right? There's little things here that are on the little exercises that are on the podium itself that you can kind of have them follow, but this is the main thing. And you can have them move their feet around as well too if they want. Watch the animals on the TV here. Tell them, don't be on your phone, head down and ruin the work you just did on the traction. Keep that phone up or just look at the screen. And this automatically times out for 10 minutes, so then they shut it down. The third piece, the spinal hygiene part, is the lumbar wobble. So this one's gonna target the low back, right? The lumbars and the pelvis. So for your keyboard warriors, people who sit down all the time on this thing, this is a 4-minute timed exercise, which is why I have the clock on the wall right there. People can time themselves, right? So they're gonna rock on this cushion here for 4 minutes in 4 different directions. And it's not about how fast they move on it, it's about quality of movement and moving in a pain-free range of motion. With any of this, you also wanna make sure you instruct people, only move to tolerance, don't move so much that it hurts, right? You wanna ease into things. A lot of people are always trying super duper hard and they don't need to do that. So you want to make sure they're in good seated posture. You don't want them slouching on this, and you don't want this cushion way back here where they're resting, right? You want to move forward, feet flat, hands on thighs here, looking straight ahead. So for 1 minute, the first motion you're going to do is the forward rock. So you stick the belly out, right? And then you tuck the tail under, right? And you do this for the first minute. So it's nice and easy. Again, just moving what's capable and easy for them to move in. And you do this for the first minute. Second minute, you'll then just go cheek to cheek, right, left to right. And it's, you know, pretty common for people to feel like, oh, I can move better in one direction, but not so much in this direction, which is why they're here, right? Compensation. So that's the second minute. Third minute, you'll make a clockwise circle. In the fourth minute, you'll make a counterclockwise circle. And that's it, right? This is moving the lumbar spine, right? It's getting the lumbopelvic articulation moving. Again, it helps those people who are spending a lot of time driving, sitting at a desk, working all day long, getting more motion into their low back. Does that make sense? Cool. So this is 4 minutes. Again, the vibe is 10. Cervical traction takes about 3 minutes or so, right? And then the final piece is the recovery chairs. So again, we have 3 different modalities on here. We've got the chair itself is a vibratory massage chair, which is nice in and of itself. The pads, so the higher dose mats that you see here are these higher dose mats are a combination of infrared heat, right? So they get nice and warm. Circulation's a good thing, right? And then they also put a PEMF field, pulse electromagnetic field, into the body. On the chart over here, just to kind of, if you want to explain, what do the buttons do? What does all this mean? So if you come over here, take a look. The different PEMF levels, 1 through 4. The different states can trigger different things in the body or different, like I guess, characteristics. So 1 is you're very, very relaxed brainwave, right? So it can people help to fall asleep, stay asleep. Maybe not what they want to do here, right? Number 2 is the Schumann response grounding. So this is equivalent to walking outside and actually grounding, like walking around barefoot, right? That's what that is. So that's a great one to have people on. Number 3, again, the alpha brainwave. This is the, you know, just being present and awake, kind of like if people are doing some brain fog and want to kind of help with that, that's a good setting there. And then number 4 is like, hey, I've got a bunch of emails I got to knock out. I got to study. I got to be focused. I got to, you know, GSD, get some stuff done. That's a good level for them to use. So they would set that. And again, here, just fire it up. This dial here controls the heat, gets nice and warm, and then the PEMF, you choose what level you want, 1, 2, 3, or 4. You can see it's working. So here's what's kind of neat. You can see the differences in the frequencies, right? So this is a little billet aluminum guy right here. See that? Okay, so if I go set it to frequency 1, 3 hertz, if you find the coil here, you can see it jumping around on the pulse, right? Here's it at 2. It increases the frequency. Again, that's at the 7.8 hertz, right? Here's level 3, the 11 hertz. And then level 4, 23 hertz. Right, as you can see the difference. So that's putting that energy into the body, right? And so this runs for 20 minutes. Okay, then the PEMF shuts off for 20 minutes. And the final thing are our Normatecs, right? So we've got the Normatec compression setup here, the big old ski boots for people to wear. Again, this is segmented compartmentalized compression or sequential compression. A lot of compression boots out there, like the ones you see at hospitals, it's one big squeeze, right? This is actually mimics the body's natural lymphatic, so it has a pressure gradient. So it starts at the feet, ankles, then works its way up, mimicking the body's own natural like circulation clearing of lymphatics and blood. So people would just put that on, slip them on like a pair of pants, zip it up nice and tight, zip it up all the way, click them into the hoses, and then just set the proper zones and let them run for 15 to 30 minutes or so. So again, it's a thing that I do want to make sure all of our patients know they have access to and can use whenever they want. And it's a part of a benefit of their being under care here.